So for this video, we're going to talk about the sphenoid bone and also the ethmoid bone. So we have our sphenoid bone located here centrally within the skull, and our ethmoid bone just anterior to it. Okay, so disarticulated, our sphenoid bone looks like so. All right, and there's a few structures on our sphenoid bone that we're going to go over disarticulated, and we'll go over all the foramen and holes within the actual skull. Okay, so first off, the body of the sphenoid is just this whole central mass of the bone. Okay, that's the body of the sphenoid. Then we have our sella turcica, which is Latin for Turkish saddle. So you can imagine you can try and sit within this saddle here. Okay, the actual depression of the saddle is our hypophyseal fossa. Again, the hypophyseal fossa is the actual depression within that sella turcica. Okay, our sphenoidal sinus we can only see within our sinus model. It's right here within our middle of our skull. That is our sphenoidal sinus, just the space within the sinus, the sphenoidal bone. We then have lesser wings and greater wings within our sphenoid bone. We have our lesser wings here and here, and our greater wings are the bigger structures surrounding it. Okay. And then on the bottom of our sphenoid bone, we have our pterygoid processes, these structures here. All right, those are our pterygoid processes. Now for the foramen of our sphenoid bone, we'll start with our optic canal going through the back of our lesser wings. And if we look in through our eye socket, we can see it as that most medial hole within the eye socket. That most medial circular hole in the eye socket is our optic canal. Just lateral to the optic canal is our superior orbital fissure. And then if we look inside the skull, we can see it here, lateral and inferior to that lesser wing. Okay. If you look just inferior to our superior orbital fissure, we have our foramen rotundum, this really round hole. And again, if we keep going inferior, we have the foramen ovale. And just lateral to that, we have the foramen spinosum. So a lot of people like to remember ROS, R-O-S, foramen rotundum, foramen ovale, and foramen spinosum. Okay? And that's